Anyway, guys, my article today is one about some really strong parents who are trying to advocate for their little girl. It comes to us from the British Broadcasting Corporation, and the headline reads, From Parents Plead for NHS Medicinal Cannabis Prescription. The parents of a 4-year-old girl with epilepsy are pleading for access to medicinal cannabis on the NHS. Clover from From in Somerset has a Cardi syndrome, a rare neurological disorder which causes her to have hundreds of seizures a week. Her parents say cannabis oil reduces the number of seizures by 90%, but it costs them almost $1,000 a month. The Department for Health and Social Care said it takes an evidence-based approach to unlicensed treatments. A spokesperson added, licensed cannabis-based medicines are refunded where there is a clear evidence of their quality, safety, and effectiveness. Clover was diagnosed with Aicardi syndrome when she was 3 years old. This is a rare genetic neurological disorder. Part of the syndrome is a type of epilepsy, which is difficult to control, and Clover's parents, Spencer and Emily, tried using frontline medications without success. They said the seizures continued to get worse and she was having hundreds every single week. They got in touch with other families who helped secure a private prescription of cannabis for Clover. She started taking the medicinal cannabis in August of 2020, and within 3 months, the number of seizures had reduced by about 90%. Medicinal cannabis can only be prescribed by a specialist doctor through the NHS. Emily said a seizure could kill her. A seizure could undo everything she's learned. Seizures are extremely harmful, powerful, frightening, and dangerous, and the risk to her is monumental. If we don't have the medication that keeps these seizures at bay, then goodness knows what could happen. Although cannabis oil was legalized for medicinal use in 2018, very few people are routinely prescribed it by the NHS, and this can only be done by a small group of specialist doctors. Now, folks, this isn't the first article that I've come to you with regards to what the NHS isn't doing for its citizens. I believe this is now perhaps the third or fourth article of different families having the same issue, having very real disorders. I mean, we're talking about seizure disorders. We know that cannabis helps alleviate seizures. We know this. And yet the NHS continues to turn a blind eye to these families and kids. And so on that note, of course, I'm going to turn it over to my fellow correspondents for feedback, but I just want to put this out there that NHS, you need to get your shit together already. You have the souls of these very fragile children on your own hands, and you're being irresponsible. And on that note, this is Mandy. Happy Monday. And what do my fellow correspondents have to say?
Government bureaucracy at its finest.
Well,
It is
let's
not
just start by
just America.
unpacking the acronyms for those who don't reside in England. NHS is what, the National Health System. So that would be
Yep.
their national medical services provider, right? Um, that's all I had to say.
It's like a blend of the FDA as well as like a single payer insurer platform.
Yeah,
I
right.
mean, they are paying people to run this like department, but certify almost no one.
American
What do they
influence is
do all day
strong.
long?
American influence and inaptitude from our bureaucratic institutions is strong. Let's
Well,
put
I
it that
mean,
way.
I don't know. You can blame it on us. I mean, look, we just because they came over here and colonized as one of the first countries doesn't mean we can export back some of our inefficiencies here. I mean, look, I think this is thematic, right? We're going to see more articles like this. We've seen plenty of articles in the past like this, and it's that rate at which health sciences catches up with large health bureaucracies and that gap. And we've seen that for a long time, right? I mean, there's a reason why there's Charlotte's Web and it was named after Charlotte. And, I can't say that everything has changed in the long period of time since those things
Rest in
happened.
peace.
We're going to see issues with children having access to psychotropic or mind altering medications, especially when they come from plant science or nutraceuticals, and where these large health bureaucracies aren't caught up with that. And I think we'll find those continue. We've seen articles like that. We've had Dr. Jean Talleyrand on. We've had challenges with children being able to access their medicine in their schools because of the type of medicine or accessing here. I thought it was kind of interesting. You know, this article's from England when they're complaining about $1,000 a month for something that's related to health insurance or healthcare. Because in America, over here, way we do it, we charge you thousands of dollars a month just to be healthy, and that's not even accessing anything. So I'm happy for them that they have a national system that at least is slow moving, but includes uh, access to healthcare for all citizens.
Yeah, but their cannabis situation is a joke. It's like all just a joke. It's not even really helping anybody.
Well, you guys, the U.S., Great Britain, and France have teamed up since the early 1900s to create a global resource and banking hegemony. And the reason Britain and the U.S. move so lockstep on drugs is because they really are in lockstep, again, financially and when it comes to resource extraction and control of the world. So as we see America loosen up, we're going to see the rest of the world loosen up, because not only do we, again, move in step with England, but we also provide billions and billions of dollars of funding to almost every country in the world that is contingent on their continuing our drug war. Otherwise, if it weren't for the billions of dollars that people are really, beholden to keep their own economies running, there'd be a lot more drug legalization going on. And that's often been the talk, pre the U.S. beginning to move towards legalizing cannabis by the states. It's often been the talk when other countries start to loosen up. That's one of the reasons Netherlands tightened up, was the U.S. started coming over and being like, yeah, we're going to be tightening up our purse strings if you keep letting all of our tourists go over there and eat a bunch of mushrooms and smoke weed. Is this thing on?
Oh yes, it's on. Just
Have
keep it
a
in front
quick
of you.
statistic.
Keep it in front of you. Keep your mic handy.
I just looked up a really interesting statistic out of Britain. It said that approximately 20,000 people have been given their medical cannabis access card. However, they estimate that more than 1.5 million are using it on the illicit market.